What if I told you one struggling medical practice went from losing $5,000 a month in marketing to generating over $100,000 in new patient revenue just by using their phone? By the end of this video, you're going to learn the exact 7 methods that I used personally to grow my practice into $1 million practice. And 3 years ago, that practice we talked about was mine. And the great thing about it is these 7 strategies all work together to create a perfect network of marketing for you, okay? Think about the last time that you ordered from Amazon. One click and everything just worked, huh? Now think about your last medical appointment. Not quite the same experience now, is it? But here's the good news. We can recreate this seamless experience in healthcare. So let me break down the numbers for you. The average patient spends 45 minutes filling out forms. The front desk staffs waste 3 hours per day on data entry. This causes practices to lose $25,000 per year annually from these scheduling inefficiencies. So let me walk you through a roadmap for week 1. I want you to replace those clipboards with tablets. I want you to automate the insurance verifications. And I also want you to do real-time eligibility checks if you're taking insurance. Then as you move on from there, week 2, you need to go ahead and do automations. What does that mean? Well, you need appointment reminders that actually work. Don't spam the patient, right? Two-way texting or communication with the patient, and automated follow-up sequences, right? Week 3, I want you to review the system. I want you to capture feedback when it's important, get the complaints from staff and patients, and fix it, right? I want you to turn that happy patient into a 5-star review, okay? And what really makes that great is now you can evaluate problems. And what all of this does is that it addresses concerns before they become an actual problem. So let's move on to week 4. You want to transform staff data entry to patient care. That'll help you reduce burnout by at least 40%. And finally, increase patient satisfaction by 80%, right? And the best part, for every dollar invested, you'll see back $3 in 90 days. That is better than my returns on the stock market right now. And this is all done by just having these efficiencies in place, okay? Now that we have that automated, let's move into the more fun tip, okay? And strategy number 2 is going to be content marketing mastery. What is that? Just like building your party in your favorite RPG like Skyrim, you need to have the perfect team and equipment in place. Now let's break this down into the right components. The first one is going to be your educational content, right? This is going to be your blog posts, your YouTube videos, your podcasts, and your patient guides. Next, you have to pick your distribution channels. What is that? Email newsletters, social media, website optimization, and SEO, we'll call it. And then community partnership. You need to create referral partners that you all work together with. And what this did for me was 67% increase in organic traffic, not paid. And that led to a 43% reduction in cost per acquisition of patient. Just crazy, right? That greatly increased my patient education by 89%, because by having these guides and information, and this is going to free you up to have more time to focus on the more complex issues at hand in your practice, okay? And just as a bonus tip, look at the content that does well organically and then turn that into paid ads, okay? And finally, you need to understand the platform culture. What I mean is, look at Instagram versus Snapchat, let's say. They both share a common media, which is pictures. But now you have to look at the age group of each platform. So you'll see on Snapchat, that audience is a bit younger. Whereas Instagram, that's a little bit more of a older crowd. Not quite the baby boomer, but lots of millennials and Gen Ys on Instagram and Facebook, right? But if you're going after the younger audience, Snapchat is great. Whereas it wouldn't be a good option if you're looking for middle-aged population. Thinking about the platform culture as well, you want to think about Google versus Meta. The great thing about Google is the search intent, which leads to buying intent, right? Whereas in Facebook and Instagram, they're not looking to buy yet, and you can be a little intrusive. So you want to make sure to frame your ads so that they don't seem silly. And if you want to learn more about this, I recommend reading the book Day Trading Attention by Gary Vee. He breaks this down perfectly. you'll be surprised about what organic content actually does well. Some of the things that I thought would do well doesn't do anything. And then the things that I thought weren't so good just went viral. It's just hit or miss. You just gotta, it's all about timing, trends, and what's going on currently, okay? But social media is just the beginning. Now that we have a plan, let's move on to the next tip, which is how to dominate the market. Now think about the last time you had a medical question. You went to Google, right? Your patients are doing the exact thing, but here's the problem. They're going to WebMD and now they think they've got cancer. And then they come to you and they said, I've done my research, I've got cancer. What's next? And that's the problem. They're getting their information from WebMD instead of you. Let's change that for you with my content domination guide. And your content strategy needs 3 core elements. What are they? It's going to be your system creation. Next is your distribution network. Third is your engagement framework, right? So let's go ahead and break these down. So your creation system can include weekly educational videos, monthly content breakdown, seasonal health tips, FAQ-based content on actual patient questions, right? Next is your distribution network. What you want to do is repurpose one large video into 10 small pieces of content. Then you can share that across each of your platforms, TikTok, Instagram, Facebook, all those. Next is don't forget to leverage newsletters. That email address is so important for you. I recommend doing a weekly newsletter. Why? One is you don't want to get on your patient's nerves by a daily or every hour update. And then you don't want to become irrelevant by not sending in enough, but you want to stay at the top of their inbox, okay? So as you can see, it's a tricky balancing act here, right? What does these success metrics look like? Well, for me, it was a 67% increase in organic traffic. And I spent less time in the appointment explaining basic concepts. And that led me to have more time to deal with more complex medical things. And here's the best part. This content works 24/7, even while you're asleep. This content continuously grows, educating patients, and it is elevating your authority in the field as that clinician to go to, okay? But now, here's where things get interesting, right? Next, we're gonna talk about digital marketing. So this might seem daunting and expensive, but what if I told you that it's 100 times more effective and profitable than traditional marketing? And that's just for one simple reason, is you can track your metrics. You can't do the same with magazines and billboards. How do you know who is actually looking at your content? How can you track that? And the answer is you can't do that with those traditional means. However, today with digital marketing, you can see where people are finding you at. Is it your Google ad? Is it off of your blog post? These are areas that you can capitalize off of. When you see patients are coming from that source, you want to double down on it. Just like if you're running a Google ad and you see that it's doing well and patients are converting, then you want to put more money into it, right? But on the other hand, if you see that your Facebook ad isn't doing so well, then you want to change the ad and pivot so that it's more effective. So that's how you can evaluate your metrics when you are marketing to your patient, okay? Let's now level up your patient acquisition strategy. And strategy number 1 is going to be your SEO optimization. This is how you become ranked on page 1 of Google Ads or Google. This will help you dominate your local search. Next, I want you to optimize the keywords that you are ranking for. Then, as part of your SEO, I want you to update your Google My Business profile. That's so important that everything is up to date and consistent across every platform, okay? And then as part of that content, I want you to do location-based content. If you're in a city like I'm in Jacksonville, then I will try to rank for Jacksonville's best primary care, or I will give updates on what's going on in healthcare in Jacksonville. That way they can see that you're on top of the news of what's going on in your city and that you've got your finger on the pulse. Next is your paid marketing strategy. I know I talked just a little bit earlier about Google and Facebook ads, but now you need to ramp it up more like your Google ads. So you want to make sure that so for your Google ads, you want to rank for words that you think that patients will find you for. For instance, primary care Jacksonville, weight loss Jacksonville, obesity medicine Tallahassee, those types of things, okay? And moving on to the meta platforms, including Facebook and Instagram, these can be a little bit tricky because they've changed their advertising policies so that you don't give dramatic before and after photos if you're doing weight loss or you're doing cosmetic things, right? So make sure that you review their ads carefully so that they don't get rejected or you don't reach your full audience. And then in Instagram, it's very visually heavy, so you can do a sponsored ad or show up as a video short, but make sure that these are not ads, so to speak. Make sure that they're just stories explaining or patient interviews so that you don't come off as salesy, okay? And if you're doing business to business, then you can think about LinkedIn ads. They're expensive, but I may go into this if you guys are interested. But you still want to have your medical practice listed on LinkedIn so that you can populate in searches, okay? So let's break these numbers down and talk about ROI. So we look at how much does it cost you to bring in a patient, and for me it was between $25 and $40, but then we look at the CLTV, we call it, the customer lifetime value. And for me, it was between $3,500 and $5,000. So that is over 300 to 500% return on my investment. And you guys can do the same thing. But what if you can automate this? That's the next thing we're going to get into, okay? And that is your email marketing automation. You know me, I like my nerd analogy. So let's go ahead and think of this as a well-designed RPG quest, right? So your automated sequences are things that go out without you even having to think about it. These can be your new patient welcome emails, which is great because then again, you can outline your practice policies, common questions, and answer a lot of things before they even get onboarded, which is very smart. And you can also remind them of appointment reminders. Oftentimes, your medical record does this, and I encourage you to take full advantage because we all forget. Hell, I forget. And not only that, you can remind patients about their preventative care, like, hey, you're overdue for a mammogram, or hey, you're overdue for a colonoscopy, right? So those helpful reminders really help me too as a patient. So how do you look at these emails is, here's some metrics, right? One is, I want you to shoot for about a 45% open rate. Next, about a 23% click-through rate on that email. This can lead to 67% patient retention and improvement of their health. And that's because you now have more touch points reminding these patients and giving them valuable information in a system that costs you almost nothing. But the next strategy changes everything. And that strategy is community building. I think you all have heard me say this over and over again, is that it takes a village, right? It takes a village to raise a patient, an entrepreneur, and hell, even a Shane. And that is going to be your secret weapon, is that will make you part of the community. If you go out and engage with the community, hosting events, education, some health fairs, if you make patients just more aware of it, they're going to see you as the dominant force of healthcare in that area. You know, think about it. If you see a face or a logo over and over again, then you finally start to think, right? And I do want you to build those community partnerships. I mean, that can include nonprofits, that can include radio stations, which I have a segment on Thursdays on 95.1, which is very fun. It's a way for me to engage with the community and also having fun and just let my genuine personality show by the way that I answer these weird questions, which is always fun, right? And so with me, I've been able to increase my referrals by over 75%. And I've gotten 90 to 95% all positive feedback on all these things. So get involved in the community, be a community partner, and honestly, your goal should be to improve the health of the city that you serve. All right, the last and most important is going to be video marketing. You're going to see why I saved this for last, because it's one of the best ways for you to engage and to recruit patients, which will lead you to be able to take care of their needs. And one of the reasons why, it has almost 20 times more engagement than just text, and then about 10 times more engagement than just pictures. If they say a picture is worth 1,000 words, then how much is a video worth, right? So let me show you how video transforms patient trust into practice growth. And I'm going to show you my proven implementation framework. So the first one, and I think is the most important one, is your patient story. You give the before and after testimonials. You can show recovery journey videos. You can talk about family experience that they're sharing with you. But just to make sure that everything is compliant with HIPAA guidelines and that you have all the consents signed and you protect the data as much as you possibly can, okay? And there are apps out there that'll help you record this patient interview, so don't even worry about that, all right? And the next kind of content is going to be the educational content. This is the part to where you can do common procedure walkthroughs, you can do treatment option comparisons, preventative care tips. You can also do FAQs. What these do for you is to help you also educate the patient and to bring down their anxiety a bit about the unknown of their procedure or coming into your office. And it makes them feel more comfortable and kind of open up more. So that's been a game changer for me. And then the third one is just the practice showcase. Show everyone hanging out, working, do team introduction videos, do a tour of your practice, and do like some demonstrations of your technology or anything like that. That way the patients can see what it's like and you're just human. And another great thing that revolves around this is just the day in the life content. I've seen this go extremely viral in TikTok especially. So the day in the life is honestly really, really great, okay? And so as I'm looking at the numbers, it's been amazing, right? Just video alone has increased website engagement by 300%. We learned that 85% of patients prefer watching over reading. And then it's been 64% increased in bookings for us. And then it's been a marked drop in reduction of pre-appointment anxiety. This has led to my first appointment being honestly much more fun for all of us together. And the great thing about it is you don't need fancy equipment. All you need is a smartphone. It's simple. You can get some good lighting and you can start. You don't need anything fancy. And then let's go ahead and talk about the timeline here, right? So let's just take this into a 4-week sort of journey. Week 1, you can do patient testimonials. Week 2, move on to educational content. Week 3, do the practice showcase. And then week 4, and then you can figure out what platforms you want to post all of this on. So wrapping up, guys, here's what marketers won't tell you. The best marketing strategy isn't really about tactics or tools, right? It's really about creating genuine connections with your patients and your community. And that's because we're not just building a business. We're building a system of trust, hope, and improving lives. Because whether you like it or not, you and I are going to be on the other side of the lab coat. So make sure you give the care that you want to have. Are you ready to supercharge your marketing efforts? Then I want you to like this video, subscribe here for weekly updates, and then download my free practice marketing guide below. And remember, just like in Skyrim, the best strategies require the right tools and proper execution. And I've been Shane Grindle, the Medpreneur, and may the force of entrepreneurship be with you.